Lovin Dubai show, our guest today is a Dubai-based cosmetic expert. She will shed light on the remarkable advancements in 3D areola restoration for breast cancer survivors, showcasing the cutting-edge techniques of medical micropigmentation utilised in enhancing their recovery journey. Welcome to the show, Chelsea Gregory. Thank you so much for joining us.
Thank you so much for having me today.
We're excited to have you.
Good morning. How are you feeling this morning?
I'm great. Thank you so much for having me. Yep.
Do you usually wake up this early?
Usually I'm waking up about now, so.
Okay, perfect. So you're a morning person.
Yeah, I am. Yeah.
We really appreciate you being here. Of course, October is Breast Cancer Awareness Month, and there's so many facets of breast cancer, from checking to the recovery journey that maybe people aren't aware of. And I think that's keenly where we can get your insights, the recovery journey. So if you can give people an insight in areola restoration and who is a candidate for it.
Sure. So medical micropigmentation is an advanced technique, and it basically restores the aesthetic to the areola where it's been affected by either surgery, through maybe a mastectomy, a breast lift, breast augmentation, and the pigmentation of the areola has been affected. So it's just basically implanting pigment back into the skin and helping, it can be men and women, to kind of put the pieces back together.
And who comes to you?
So a candidate is really anyone that's been affected, their areola or nipple has been affected through either surgery, or it could even be a skin condition. Mm-hmm. But a lot of the cases are breast cancer. So that's usually either mastectomy, a lumpectomy. It can be unilateral, bilateral. Sometimes I have cases where I have to match one areola to the other.
So how does it work exactly? How do you get the 3D result? And, how do you make sure it's hyper realistic?
So if you think about, art and how to achieve, shadows, through shadows and highlights, you're creating a 3D effect. If you take a piece of paper and you draw a circle on there and you need to make it look like a ball, you need to add shadows and highlights. So it's the same kind of thing. Lots of colors, lots of, depth, highlights. And,
do you feel like this restores a person's confidence as well? Do you see a difference in that aspect?
Definitely, of course. I mean, especially, patients that have been through something as traumatic as breast cancer or a mastectomy, it's a very disturbing feeling to look in the mirror and not recognize the body that you've known your whole life. Mm-hmm. Right. So this treatment is kind of like the final piece of restoring and putting the pieces of the puzzle back together for women.
This is what I was going to ask. At what stage do people get in touch with you? At what stage of their journey would they reach out for this type of help?
So women come to me at two stages. So either the very beginning of their journey or at the very end. So at the beginning, they come to me because I sometimes do their eyebrows. One thing that people don't consider is that, when you lose your hair through chemotherapy, you can cover it with a scarf or a wig. But when you lose your eyebrows, it can be, it affects your face. If you've seen any of those memes where sometimes they remove celebrities' eyebrows, you look quite, it's quite different. So with the weather here and being so hot and humid, drawing them on every day is, with rubbing, they come off and getting them even. So a lot of patients come to me at the very beginning, before they start chemotherapy, they've just been diagnosed, or they come to me at the very, very end after all their treatments. And my work with breasts and areola restoration is the very last thing. So very beginning and the very end.
So we're talking physical restoration, which we'll get back to, and I'm really interested in how 3D technology has advanced in the work that you do, but also about the mental well-being of the person. Is it challenging for you dealing with each patient during their recovery process?
Yes, it is challenging, but I'm always inspired by women that I meet, their strength. I see women younger and younger every year coming through with breast cancer, with young families. A lot of them still work through their treatments. And I feel honored, and it's a privilege to be able to, add such a positive contribution to their journey. I've always kind of prided myself on my ability to be able to connect with my patients. And, I feel that I can definitely help them restore the physical pieces, but also the psychological aspect. I completed a course with the George Washington University in patient oncology navigation. about 3 years ago, just so I could help understand the needs of my patients better and how I can help them more.
Interesting.
So this process, I just want to ask, like, is it painful? How long does it stay for? Is it a permanent situation? Or is it something like, you need to keep going and getting touch-ups for?
Good question. The results last, I'm going to say, sort of 5 to 8 years, but they don't fade out completely. You may just need a little bit of touch-up work. It's not painful. Usually when someone's had, especially a mastectomy, something as extreme as that, a lot of the nerve endings are kind of severed, so it's not painful. However, in cases where I may have someone that's had a breast lift or a breast augmentation, there may still be some feeling there, and so I have a very strong medical grade anesthetic, so it's not painful.
And how has technology involved? When you started down this line of treatment, were we talking 3D then? And when you say 3D, what exactly do you mean? I know you mentioned earlier, but...
Yeah, so you can imagine, when your areola and nipple is removed, it's just skin there. So the process is, as I said, creating shadows and highlights to make it look 3D. So sometimes it's so hyper realistic that when I show people pictures, they ask me, so are you stitching a new nipple? It looks so hyper realistic, fortunately. So the advancements, I think, of every year it gets better and better for sure. The tools, the products, the quality of pigments. So there's great advancements in the past 10 years. So.
And it doesn't interfere with any treatment, because you said women come to you before their treatment. So do they come for consultation before, right? So as soon as they get diagnosed, they come to you and have that consultation, after the treatments, after everything is done, we're going to go through with this process?
Sometimes they come to me before, but generally speaking, they come to me at the very end. They're aware, their surgeon will make them aware that this is part of the process, but they come to me at the end. And so I will do a really thorough consultation. I will explain everything. So I have an app that I use, and I can draw on my iPad just to give them an understanding of exactly how it will look. And I often encourage them to bring pictures of how their breasts used to look, and I can try and create that as close as I possibly can, so that they can recognize themselves how they used to be.
Are there any circumstances in which you'd recommend for a patient not to go ahead with this treatment?
No. No. I mean, unless they're really not ready psychologically. But usually I haven't really had any cases like that. Usually people are really keen to kind of restore their body and, move on with their life and start a new chapter. Like I said, it's at the very end. So generally they're ready to put this part of their life behind them.
Even if they've had prior surgeries done to their breasts beforehand, it's still okay to get this?
Yeah, it's fine, as long as everything is fully healed. So even after the last surgery, usually patients will go through a lumpectomy, and then they have their surgery and either chemotherapy, radiation. So they're going through a lot. So at the very, very, very end of that, by then usually everything is fully healed. Around 6 to 9 months is the waiting time generally.
And how common is it for patients, maybe after everything's been through, how common is it for patients to be aware of micropigmentation and to go through with it? How do they hear about your work? Is it regular for patients?
It's really challenging to spread the word about this work, because we can't show images of my work. So it is definitely challenging. I rely heavily on, number one, word of mouth. Number two, surgeons. I'm based at American Hospital. However, I was a keynote speaker at the Emirates Plastic Surgeon Society in 2020. And I was able to get, a lot of surgeons in the room at one time, a lot of oncoplasts and plastic surgeons. And, I rely on them to let patients know. Platforms like this are always wonderful, because, women are so connected to their breasts, their physical body, and their sexuality. So many things are connected with their breasts. So restoring this for them is so important. And in case it's missed by one of the surgeons, platforms like this really help me to be able to spread the word about the work.
You've been in this field for a very long time, like 20 years. So can you tell me, like, what were some of the most difficult aspects that come with this job? Like even dealing with a patient or like personally, like, do you have any?
I guess, it's something that you're always perfecting your craft. It's, you have to be artistic, you have to have a great attention to detail, and you have to have technical ability. So it's something that it's not easy. It's like anything that, you want to be good at, you have to work hard at it. So that's definitely something that I'm always working on being better. And of course, the other challenge is, of course, just letting people know this treatment exists in a region like Dubai, like UAE.
Speaking on the attention to detail and the intricacy of your work, when you started on the medical route, did you know that you were would go down a route of needing to be an artist as well as a surgeon? Yes, I did. And I think that there's certain things that you can learn, but there's sometimes an innate ability that needs to be there, or a deep-seated passion. And definitely I was always, an artistic kind of person. And then, the basis of my training was, of course, semi-permanent makeup. I mean, everyone knows microblading, micropigmentation. And then after I think I'd completed about 5,000 treatments, I then decided to challenge myself and do medical micropigmentation. And then I kind of carved out a niche. It's kind of like a niche within a niche, areola restoration. Mm-hmm. And, so I just, when you do repetition, you get better and better and better and better and better. So. Well, speaking of using this platform for a better cause, how can people find you? And I think to see the images would help people truly understand what you do. We don't have the photos here, but how can people see the photos to kind of get a proper insight in the work that you do?
I have posted something on my Instagram today, and I would encourage anyone that has anything that they don't like about the areola, their nipple, to reach out, and I can share my extensive portfolio one-to-one. I don't send anything over WhatsApp or share anyone's images. It's all, in person. And you can reach me either through Instagram or my website. I'm based at American Hospital, but you can reach out to me directly.
Brilliant. Thank you so much for your time this morning.
Thank you so much for having me. I appreciate it.
That was Chelsea Gregory. We really appreciate your time this morning on this Monday morning. It's 9:05, and that is the end of the show, guys. Thank you so much for tuning in. We're back with you tomorrow morning, same time, same place. Goodbye from me.